Hi there, Kendra Tolbert here. I'm a registered dietitian and yoga teacher, and I specialize in preconception preparation, fertility, and women's health. And today I'm going to be talking about that first bit there, that preconception preparation bit. That's what I'm going to be talking about today by answering some of your preconception preparation questions. So for all of you who submitted questions, thank you. I will be answering those right now. Let's get right into it. First question, are there any fertility tests that a couple should take if they are in the preconception phase so they have better clarity preparing for pregnancy? I love this question so much because this person pointed out that it takes two, right? They asked about the couple, what the couple should do. If you're in a heterosexual relationship where both the male and the female partner are going to be contributing genetic material, both partners' health, both partners' fertility, reproductive health, all that matters for both partners, not just the female partner. I think too much responsibility is placed on the female partner, and the male partner kind of gets ignored as if somehow they aren't also contributing to the health of the pregnancy, the health of the future child, and fertility. They are. So both partners matter. Thank you for pointing that out. I do have a video that's actually focused more so, after I said all that, on female fertility, because that tends to be where I focus my attention. And in that video, I talk all about preconception care appointments and labs that I would recommend and provider types that I would recommend exploring. So I'll make sure to link to that down below. It's going to go far deeper than I am able to go into in this video. But for this video, I really only have two things to say: what I don't recommend, and then the type of appointment I would recommend so that your provider can help you decide what sort of labs make the most sense for where you and your partner are. So the first thing I'm gonna say is I don't recommend those at-home fertility tests because they don't provide the context that you get when you have an appointment with a provider who has a chance to assess your lifestyle history, your lifestyle habits, your family history, your health history. When you just get those labs, that's it. Like, there's no follow-up questions. There's no questions beforehand to understand what these labs mean in context. So I'm not a huge fan of those at-home tests because if you do discover something, you still got to go to the doctor. Like, you might, and there's a really good chance that your provider is then going to have those labs repeated anyway. So what do they really provide us with? At least that's where I stand. And I think some of those tests are giving people like anxiety based on those results that they don't need to be experiencing, and possibly giving some people like a false assurance that they shouldn't have. So have your provider do your labs is what I recommend rather than doing those at-home tests. Next thing that I would say is simply schedule a preconception preparation appointment with your OBGYN or your nurse midwife or your women's health nurse practitioner. Let them know, hey, I am planning to start trying to conceive and I would like to start receiving preconception care, or I'd like to have a preconception appointment. They'll schedule you for that. Then they'll help you decide which labs would be best for you. For the male partner, same thing, right? Talk to your provider and say, hey, me and my partner are planning to start trying to conceive. I'd like to come in for an appointment to have my health assessed for preconception, like planning and preparation. They'll take care of it from there. They'll know what to do. So that's what I'd recommend. And that's what I wouldn't recommend. So I wouldn't recommend at home because you don't have the benefits of context. And then I would recommend simply having a conversation with your provider about preconception planning. They'll know what sort of labs to have you do based on your health history and your family history. That's what I'd recommend. I hope that helps. All right, question number 2, and it actually comes from the same person, so it starts also. Also, how and when does one choose an OBGYN for their pregnancy? Another great question. So the how is a little bit more complicated, maybe not complicated, but complex. The when is a little simpler, so we'll dive right into the when first. So the when is, or here's what I would recommend. I would recommend the second you get a positive pregnancy test, you call your OBGYN and you let them know, hey, I just got a positive pregnancy test. I'd like to start prenatal care. They will take care of when to schedule you, right? Like it also depends on what their schedule looks like. So you find out you're pregnant, you call an OBGYN's office, you let them know you'd like to receive prenatal care. That's the when. The how, lots of different things to look at here, right? You asked specifically about OBGYNs. I always want to make a plug for midwives because I think they are lovely. And if you have access to one, could be another form or model of care that you resonate with. So first thing I would say is decide what model of care you would like. Would you like to work with an OBGYN? Would you like to work with a midwife? Would you like to be in a practice that has a combination of the two? So that's where I'd start. The next thing is, do you already have a relationship with a midwife or an OBGYN that you feel very comfortable and confident with and in? Because if you do, right, the person who's already doing your pelvic exams, your pap smears, your annual exams, you could just continue with that person or their practice. Or if they don't provide that type of care that you're looking for, they may have someone that they would refer to. So it may be a matter of, in that preconception appointment, saying, hey, are there OBGYNs that you would refer to if you aren't an option for me? If they're an option for you, you already have someone that you feel comfortable and confident with. No reason to feel that you may have to change. You may have to, but you may not have to. So that could be something to explore there. The other how that I would take a look at or consider is what we do when we're looking for any other sort of service, right? We turn to our friends, we turn to our family, we turn to our coworkers. If there are people who you know have, relationships with OBGYNs because maybe they experienced a pregnancy, maybe they are an OBGYN, I don't know. You can ask in that way, and you can ask about their experience with someone. You can also, of course, look online and see what different people's experiences were with providers in your area. You can call your insurance company and look at the directory, because you also want to make sure, if you're going to be using insurance to cover your care, that your insurance covers the person that you're looking for. You don't want any surprises there, so that's a part of it. You may contact a doula in the area, and they may have a list of providers that they work with or recommend, because they're going to have experience probably a lot of different providers, so they'll know a bit. There are some doulas that actually specialize in preconception preparation and fertility, so they may be a great resource to get an idea of who the providers are in your area. What else would I say to this? Actually, this doesn't come from me. This comes from Erika Lawson Watson. It may be Erika Watson Lawson. Either way, she is an amazing dietitian and doula. And we had a little chit chat a couple of weeks ago, and she shared something that I was like, oh yeah, that makes total sense. What she said, and I'll make sure to link to her information below because you may want to reach out to her. She may provide you with some guidance as well. She shared that it's a really good idea to pay attention to not just how that provider treats you, but how they treat their staff and how their staff interacts and how their staff treats you when you call in, when you come in, sign in for your appointment, how they treat the other people in the waiting room, right? Like you want to notice all of those things because that tells you a lot about the dynamic. And if you're in an environment that doesn't feel good to you, you want to be in an environment and around staff and around providers that put you at ease. So that was a lot, but that's what I would recommend taking a look at when deciding who you want to work with. And that's kind of the how, right? It's lots of questions. Always lots of questions. Next question. Can a retroverted uterus cause infertility? And can it be corrected through yoga? Really good question. So, not to my knowledge that it can be corrected with yoga. I don't even want to say possibly, just because I haven't personally worked with anyone with a retroverted uterus who was trying to correct it with yoga. This is a case where I think your best bet is to have a conversation with your provider and ask, is this something that needs to be treated? Is this something that I need to be concerned about? If they say yes, if they say no, then you kind of know where to go from there. And it's also a case where you may want to reach out to a physical therapist or a massage therapist who specializes in the pelvis, because they're going to look at these sorts of things differently than your conventional provider might. This is not something that I would try to correct at home with yoga videos. Not something I would recommend at all. That said, though, I do think yoga could be a lovely adjunct to the care that you would receive from a physical therapist, massage therapist, and conventional provider. That's what I have to say about that. So I don't really have much more, but I do hope that this at least sends you in the right direction towards other providers who can give you a different way of looking at this and addressing it. So I don't know that I actually answered the first bit of that question, though, which was, can it cause infertility? What I have heard from a physical therapist who actually was on this channel, I think she actually talked about it, I'll link to her video, was kind of like, it depends on who you talk to. Some providers say absolutely not. Other providers say, of course, form influences function. So it probably depends on, the specific orientation, how severe it is, whether or not it can be corrected with manual therapy, massage therapy, physical therapy, whether or not it needs to be addressed surgically. So all of those things play a role in how it may or may not influence someone's fertility and reproductive health. So speak to people who can ask really good questions and provide you with lots of alternatives. Alternatives in terms of care. And by speak to people, I mean go to the professionals, talk to physical therapists, talk to massage therapists locally, go to them, have conversations with them, get care from them. I don't mean kind of scour the internet and send people DMs messages. I'm not saying that's what you're going to do, so please know that's not what I mean. I just know that sometimes my DMs are filled with questions that I'm like, I can't answer that because I haven't seen you, I haven't spoken to you, I haven't had the chance to ask you questions. And while I think the internet is a beautiful place to get a lot of great information, it doesn't, in my opinion, replace the fact that sometimes we need someone to literally put their hands on us and understand what is going on with our individual health. So I do hope that helps. Next question, and this one is a bit long, so there's a really good chance I'm going to keep diverting my eyes to it while I answer it, but let's go ahead and read it first. Seeking any recommendations for myself, a 35-year-old African-American woman seeking to become pregnant. History of 2 ectopic pregnancies and uterine fibroids. I've recently become interested in a holistic approach, which is how I found your channel. I've done IUI in the past, but I'm not interested in full medical intervention as of now. I've started exploring herbs for healing my body and recently purchased a Mira analyzer to help track my cycle and identify any issues there. Last month, I ovulated on cycle day 19. Any suggestions and thoughts on that as well? So as I said, there's a lot here, and I want to make sure that I answer as much of it as I possibly can while remaining in my scope and while respecting the fact that there's so much I would ask you that I won't have a chance to ask you because you and I aren't sitting across from one another. And I feel like we should pause there for a moment, right? Before I even answer the question. There's only so much that someone online can provide you with unless they're working with you one-on-one, because I can only provide good answers to the degree that I'm able to ask good questions. And I think it's really important to remember that when you're reaching out to people online and asking them questions, they may or may not be able to give you the full answer. They may only be able to refer you to other people who can ask you really good questions, because that's how you get really good answers. So this wasn't actually directly related to what this person was asking, and it definitely wasn't me being like, this is why I'm not going to be able to give you a decent answer. It was just something that popped into my head because it's something that comes up quite a bit. The first thing with this question that stands out to me is the history of the 2 ectopic pregnancies. And remember that I'm going to be answering this through the lens of someone who has training as a registered dietitian, who has training as a yoga teacher, and within that yoga teacher training, as well as training in herbalism and aromatherapy, and within all of that, a lot of my teachers, I'm doing this one because it's the yoga part. It was the one that I think it was the one that I pressed for yoga. My teachers have been, or my instructors and my trainers have been people who have a focus on traditional Chinese medicine. So that influences how I look at the body, and different providers are looking at the body through different lenses, and that influences the sort of recommendations they would make. So as someone with that particular training, when I see ectopic pregnancy, I get really curious about the health of the fallopian tubes. I get really curious about whether or not there are anatomical things that can only be addressed via surgery, whether there are spasms happening in the uterine tubes, fallopian tubes, uterine tubes. There's some debate about what to call them now. That can be addressed manually, that can be addressed through like things like traditional Chinese medicine, right? So are there things like inflammation happening? Are there blockages? Where are the blockages if there are? So as you can see, there's lots of questions rather than lots of answers. So I get really curious when I see ectopic pregnancies about the health of the uterine tubes. And so that could be a conversation to have with your provider. What's going on with my fallopian tubes or uterine tubes? Okay, we'll talk. There's a debate out there about what to call them. So that would be my first recommendation, is get curious about that and talk to people who can help you understand what may or may not be going on there in your unique body. And then when I see uterine fibroids, I also think, how large are these fibroids? Where are they? Are they something that your provider has decided it's really not a problem, it's just kind of like a watch and see sort of thing? Has your provider recommended surgery? Are there things going on lifestyle-wise that could be contributing to them? So lots and lots of questions. And so in that, and all of those questions that I'm not able to ask you, what I'm left with is the importance of encouraging you to have conversations with different provider types, right? So talking to an OBGYN, possibly talking to like a women's health nurse practitioner or a midwife, talking to a doctor of traditional Chinese medicine who focuses on reproductive health and women's health, talking to a physical therapist, talking to a massage therapist. These are all people that could support you as you attempt to address this in a way that feels aligned with your view of the body and your view of the health and how you would like to approach your health in your body. So that's really my recommendation, is like, talk to those providers who can help you address what may or may not be going on in your health. You also mentioned that you're looking into herbs. Traditional Chinese medicine providers can provide herbal guidance, but there are also herbalists. So are you kind of DIYing this? Are you exploring this with different providers who specialize in herbalism? Some midwives also provide herbalism as a part of their care. So as you can see, there's lots of different people that you may want to have conversations with. So my ultimate recommendation is to get curious, decide what types of providers you're most comfortable with, and start working with those providers if you have access to them. The last thing that I want to talk about in this question is the part where you talked about ovulating on cycle day 19. I'm not sure if you were stating this as if it were a problem or if it was just like something that you were sharing. Because I can't ask you, I really wish I could. What I will say is that I know that a lot of people think if they're not ovulating on day 14, then something is wrong. Like, we're not robots and our bodies don't really care what the textbooks have to say. So this could be perfectly acceptable and normal for your cycle. So it depends on the context that you were sharing this in, and it also depends on the other parameters of your cycle as to whether or not this is good and normal and acceptable for your body. So I hope I answered your question. I know I did the best I possibly could, so I'm wishing you all the best. That's definitely true. Next question. I am 38, planning for my second pregnancy since 2 years after going through all checkups and fertility treatment. Should I still plan? Absolutely, you should still plan. Each pregnancy is different and a lot has changed since you were pregnant 2 years ago. So I think still go through the preconception preparation process of having a conversation with your provider about your plans, making any necessary lifestyle changes, taking any necessary supplements. Those are all things I would recommend, even if it's your second pregnancy, because things have changed in those 2 years. I think of it as like if I ran a marathon 2 years ago and now I'm like, I want to run another marathon. I'm not going to be like, oh, I ran one 2 years ago. I don't need to train like I did for that first one. I still need to train for this marathon. This is a new marathon I haven't been training for it. So I might need to train differently because my body is different 2 years later than it was 2 years ago. So if you think of it that way, I think it always makes sense to plan. If you have the time and the privilege and the ability to plan, prepare. It never hurts to prepare yourself for what's to come. Next question. Hi there. I really enjoy your sequences and just your overall tone and take on this often hard journey. I'm just getting ready to start IVF and would like to know if there are specific sequences tailored for this journey or if most are safe, but maybe with a few modifications. Thank you for what you do. Thank you for your kind words. I really do appreciate just the thank yous because it means a lot to know that these videos are reaching the people that I intend for them to reach. So to answer your question, there are some modifications that I would recommend if someone still wants to explore other types of yoga videos, or even if they're doing a fertility yoga video, whoever created it, including me, we may not have been considering the specific phase of treatment or phase of your cycle that you're in when we created that, right? Because we're not working with you one-on-one. So in general, during stimming, or I should say the day of a retrieval and like a couple of days after a retrieval, the day of a transfer and a couple of days after a transfer, I don't recommend twists, especially like a deep twist. I don't recommend like super deep back bends. I don't recommend inversions. And I wouldn't recommend anything that feels really strenuous, like a heated practice or just like a really fast flow, for obvious reasons. I think they're obvious reasons, right? Because like your abdomen's all like swollen and tender and stuff. But also there is a risk of torsion, right? Of your like tubes, your ovaries actually like twisting, and we don't want that for you. So that's what I would recommend. And of course, listen to whatever your care team is recommending as well. So have a conversation with your care team. There may be things that they're telling you to recommend. On my channel, I do have one video that was specifically designed for people who are preparing to start IVF. So it's a great video up until stimming starts. In general, I would recommend just exploring the other fertility sequences up until stimming starts. I don't have videos on my channel right now that are like stimming specific. There are some that are like IVF specific, other than that one that's for preparing for IVF. So sometimes, and it depends on the video, sometimes I would say like, hey, if you're stimming, do this pose instead of this pose. I don't do that consistently, in part because that's not really like my focus. Also because I don't have a chance to get to know y'all like one-on-one to really understand like what you're experiencing, what you're going through. Like it's not a group class in person or even virtually where I can say like, hey, what phase of treatment are you in? And I can kind of tailor it in my mind, right? Like I kind of have to think broadly and teach broadly. So it's not something I always touch on, but there is another fertility yoga teacher and she has a program. I believe her name is Erin. Don't quote me on that, but I will link to her website down below. She has Fertile Hope Yoga. And I do think that she actually has like treatment specific sequences that you get access to as a part of her program. So that may be something to explore. Okay, another question. Can UTIs and yeast infections prevent conception? This is a really good question, and one that I can't answer definitively because treating these sorts of things would be outside of my scope. So I don't really think of it as like, will this prevent conception, as much as when I take a step back and I just think about overall health, I think a couple of things. The first thing that comes to mind is when I'm thinking about your overall health, my focus isn't just on conception. So it's like we should probably be treating the UTI and the yeast infection either way, right? Like it's not like, oh, well, it stopped me from conceiving, because if it will, then I'll treat it. But if it won't, then kind of I don't care. I'm not suggesting that's what you say or what you're thinking. That's where my brain immediately goes, is like, I don't know if we have research that says like UTI will stop pregnancy, yeast infection will stop pregnancy. My brain just goes like, we need to treat the UTI and the yeast infection either way. So that's just kind of where I ended up. The other thing that I think about is just like, if you are trying to conceive and you are experiencing both of these things, then there's a possibility that there are underlying issues that can contribute to an increased risk of experiencing infertility or difficulty conceiving or subfertility, that could be driving the yeast infection and the UTI. So those things would need to be addressed in order to optimize your chances. The other thing that I think about is that both of these are things that you have an increased risk of experiencing once you are pregnant. So you want to treat them before you get pregnant. So ultimately, where I land is, I don't know. Part of me is like, it would make sense that they would, right? Like it's an infection. So that's one way that your body has to divert resources in order to manage an infection. So it kind of, in my head, my thinking in this moment, like deprioritizes reproduction, because right now we just need to stay healthy. So possibly. And the other part is like, you just deserve to feel well, and UTIs and yeast infections are uncomfortable. So like, we just need to treat those. I don't know that we need to think about it in terms of like, will it prevent me from conceiving or not, as much as like, I deserve to not be constantly experiencing these things, or experiencing these things even just once, right? Like it needs to be addressed either way. I feel like I didn't fully answer that, but I kind of did. I hope I did. You'll let me know. All right. Oh, one other thing that comes to mind is the microbiome and the vaginal microbiome. And we do know that the vaginal microbiome in general, does have an impact on fertility, or does seem to be associated with fertility. And so if you're experiencing a yeast infection, if you're experiencing infections in general, then we do have, I think we can kind of assume that perhaps your vaginal flora is not optimal for optimal fertility. So you would want to address that if you're actively trying to conceive. Not to mention, if you're trying to conceive through intercourse, if you have a yeast infection, and I'm adding this in, if you have any other sort of like vaginal infection, you would want to address that before resuming intercourse. So that's where I've landed on that one. Yeah. You should probably ask an OBGYN that question. Either way, I think that needs to be addressed. Next question. What would you recommend for women with irregular cycles? I'm going to sound like a broken record. Get curious. Talk to your providers. That's what I would recommend, because irregular cycles can have a lot of different underlying causes, and those underlying causes would need to be addressed. So is it PCOS? Is it over-exercising and under-eating? Is it a thyroid condition, right? Like, what's causing the cycles to be irregular? Because that needs to be addressed in order to improve your overall health, which matters because you matter, and your reproductive health. So get curious about why. And in that, if you can identify your fertile window, even if it's irregular, you can still potentially get pregnant if you ovulate. Potentially, right? So get to know your cycle in general, like know when you are in your fertile window, and work with a provider to understand what's driving your irregular cycles and treat whatever the underlying cause of the irregularity is. That's what I would recommend. We are coming up on our last two questions. This one is a bit long, so let's get into this one. What can I do for PCOS, endometriosis, and hyperprolactinemia? I've recently had laparoscopy and my endometriotic cysts removed. My prolactin is not getting under control, and my fertility consultant wants an immediate IVF cycle after removal of cysts, but prolactin is high. What can I do? My T3 and T4 came back normal, and I'm a very anxious person. I have irritable bowel disease and dairy intolerance and allergies to 2 drugs. I am in a larger body. My weight doesn't come down easily. I don't know what I would be doing with my diet and exercise. Oh, I don't know what I should be doing with my diet and exercise. Should I make it harder or easier? But easier makes weight loss even harder. Intense workouts cause so much stress, body aches and fatigue, and more anxiety and irritability. I don't know what is right for me anymore. I need to breathe after that. One, I was reading very fast, but also that is a lot to be experiencing in your body and in your life. And it makes sense that you are at a place where you're like, I just don't know what to do anymore. When I work with someone and they come to me with like a long list of concerns, it's so easy for me to want to like attack each symptom and attack each lab. But I've never found that to be a good way of focusing in on health. So what I often recommend is slowing down, getting back to the basics and the foundational truths of what supports our health. Because at the end of the day, no matter what our labs are saying or doing, there's only so much that you and I can do in terms of self-care and lifestyle and behaviors and all that. And if we're not doing those foundational things, we should expect our labs to be in an abnormal place. So if this person came to me one-on-one, y'all already know, I'd ask a lot of questions, right? Like I'd have tons and tons and tons of questions for them to try to understand where we can possibly intervene lifestyle-wise. And that's where I would start. Like I would look at how this person is living first and foremost. So what can we do to improve your sleep habits? What can we do to improve your stress levels? What can we do to get you moving in a way that feels supportive? Because you made it very clear strenuous exercise ain't it for you. So we're not going to do that. I never think hard diets, restrictive diets are the way to go. Our bodies need fuel and they need nutrients in order to heal. So what can we do to make sure that you're eating enough and that you're eating a wide variety of foods and you're eating foods that feel good to you, but also taste really good to you? Because I think that pleasure contributes to our health in ways that we overlook. So that's what I'd recommend. I'd recommend breathing, remembering that there's only so much that's within your control, and focusing on gentle, simple, compassionate self-care. That's what I would recommend. That's where I would start. You also said you don't know what you should do anymore, right? You don't know what is right for you anymore. I don't have a chance to ask you, so I'm making a bit of a leap here. One of the things I wonder is, how much time are you spending online looking for what to do? Because that can make it really, really difficult to know what to do when you're constantly inundated with conflicting information, or you read one thing that says do this for your endometriosis, but it's the exact opposite of what they said to do for your PCOS, and that's a different thing than they said to do for your high prolactin, right? Like you end up confused. Back to the basics. What do human bodies need to be well? They need sleep. They need pleasure. They need joy. They need play. They need time in nature. They need connection with others that help them feel safe and loved. They need good care, right? Like good medical care. They need a diversity of nutrients, which comes simply by eating a diversity of foods, right? Like a variety of foods. They need to eat enough. They need a sense of purpose and hope. Like that's what humans need to be well. That's where I would start. Meditation, prayer, journaling, right? Like what makes you feel good? Oftentimes those are also the things that help you be well. So yeah, I kind of just want to work with you one-on-one. If you're in the States, that may be something that you want to explore. I do work with people one-on-one where I get to ask the questions that I'm like, oh, I really want to ask. So yeah, I hope that helps. Get back to the basics, foundational truths. Besides that, you may want to also have a conversation with different provider types, right? So traditional Chinese medicine providers, herbalists, Ayurvedic providers, people who are looking at health maybe through a different lens than the one provider who you've spoken to. Those are also things to explore. I'm wishing you all the best. Best wishes. Okay, so we're at our final question. For those of us who have been fortunate enough to conceive, what are some good resources, podcasts, programs you recommend that align with your values and what you've been sharing? Congrats. Yeah, I love when I get to hear about the positive pregnancy test and I get to hear about the little babies running about. Seriously, if you get pregnant, like let me know. I want to know all about it. Let's see. So who would I recommend? There are 3 dietitians that come to mind. There are probably tons more out there. And honestly, I need to do a better job of continuing to share prenatal and postpartum resources because a lot of y'all are getting pregnant and I want to continue to help you. I don't want it to end here. What is the shimmy? I don't know. Crystal Karges, she is a dietitian in San Diego who has like a non-diet approach. So she may be someone to take a look at. Lindsay Stenovec, I don't know if I'm saying her name right. She's also, I believe, in San Diego. Also has like a body neutral, body positive sort of approach to pregnancy and postpartum nutrition. And Mckenzie Caldwell, who is also in California. Yo, maybe I should move to California because that's where my people are. And I'm from San Diego. I don't know if y'all know this. You didn't ask, but yeah, I'm from San Diego, born and raised. Most of from birth to 18, I was there. There were a couple of moments where I was like in Texas for less than a year, and I was in Missouri for less than a year, but like San Diego was home to me. Anyway, I do miss Southern California. Beaches. Beaches and the weather and the mountains. So yes, those 3 Californians could be people that you would want to follow. I don't know if they have programs. I do believe they work with people one-on-one. They might have programs as well. Another person that comes to mind is Deb Flashenberg. She is the owner of Prenatal Yoga Center, and her teaching is amazing. So she's actually been on the channel to talk about her journey with conceiving and pregnancy in her late 30s and early 40s. So she is a lovely person. I will make sure to link to all of their information down below. This was a long video, y'all. I do hope that you got a lot out of it. I will do these Q&As sporadically, so definitely make sure that you are heading over to the community tab because that is where I tend to post the call for questions. All right, enjoy the rest of your day. Be well, and bye for now.